I started my professional career in 1974, many years ago, at the Institute of Tropical Medicine in Antwerp. And 2 years later, I was part of the team that isolated for the first time the Ebola virus, which was really creating a big epidemic in what was then called Zaire, now the Democratic Republic of Congo. We isolated it here because it was not possible to isolate the virus in Congo in these days. Today, in the lab of Professor Muyembe at the INRB in Kinshasa, they can do gene sequencing and they can do the most sophisticated techniques when it comes to viruses and other infectious diseases. This illustrates a fantastic progress, and also it is exemplary of centers of excellence in terms of innovation, of medical research that you now find all around the world, including in Africa. We've made enormous progress over the last 25 years when it comes to global health. For example, today only half of the children under 5 who used to die are now dying, thanks to interventions. People are no longer dying uniformly from HIV, including in poorest countries. We have malaria declines, so on. And this is due to at least 3 factors. One, innovation. We have vaccines, new vaccines that save lives. We have treatment for HIV, which used to be a death sentence. We have bed nets that protect us from mosquitoes and, that protect you against malaria. Sounds very simple, but you have to demonstrate it, that it works. And the Institute of Tropical Medicine in Antwerp has greatly contributed to these discoveries and to this innovation. Secondly, of course, money. There was a great increase of funding, both for innovation, for research, and also for delivering it in our partner countries. And Belgium and the Institute have played quite a role in this. And thirdly, something that you cannot replace is collaboration, is partnerships. You can't do this alone. And these partnerships are absolutely crucial for success. We can always learn from each other, and it's a two-way street. The time is gone that we thought that we know it all best here in Europe or America, and what's good is for low-income countries. Today, innovation comes also from the poorer nations, where they can develop new approaches that can also be very useful for us. And my mantra is always that nobody is too wealthy not to learn something useful from others, and nobody is too poor not to have to offer something that is useful for the rest of the world. So the mantra is, we need innovation, we need research, we need these investments, and we need to do it in collaboration, in strong partnerships. And that's why the Institute of Tropical Medicine in Antwerp is such a stellar example.